IGA has 60 member organizations and it is still growing. As we are aware that not all countries have patient groups or organizations about Gaucher disease, we are always open and supportive to families regarding diagnosis, information, treatment, and care. This is why we started the Regional Manager Program. It got rebranded in the Global Gaucher Connect program, and our regional managers became Gaucher leaders. Together with our volunteers, we are now able to cover 62 more countries on top of our members. The Gaucher leaders are volunteers who gather information and knowledge. They share information and raise awareness on Gaucher disease, focusing on regions where the most help is needed. We will start with Africa as a challenge, but also as an example of how communication and collaboration with the right partners got us to achieve much more than we expected.
The leadership program by International Gaucher Alliance has also been really instrumental in not just raising awareness in the community, but in also increasing the knowledge of medical health practitioners. In Kenya, we were able to have an online platform where 1,000 doctors were able to attend, and they were upskilled in their knowledge around Gaucher disease. This program has really helped to increase diagnosis and access to the treatment of people who are living with Gaucher. We are aware of the different pathways where you can get a diagnosis, and we are aware of different opportunities for us to access treatment for diagnosed Gaucher patients. And therefore, we hope to continue to expand this program to be able to meet the needs of more and more people in our communities, as we hope to make sure that no child dies from Gaucher disease.
Our activities in Africa are possible because we have the right partners, and one of them is the organization A Rare Cause.
Africa is known for its wonderful beaches, its wildlife, the safaris, but the patients with rare diseases are completely forgotten. And that's been our passion for many years, reaching those in sub-Saharan Africa on a long journey to a diagnosis and management with a rare disease. But for rare disease patients to have benefit, they need, as we say in Africa, a village, and that village needs partners. One of the partners we had right from the beginning was the International Gaucher Alliance, or the IGA. Together with them, we've started building this village, and it's become more and more tangible that at the moment we have now a project called the Roadmap to Africa. This roadmap actually already has 8 expert centers, which has been set up with some clinical experts, some connections to get testing done for not only Gaucher disease, but other lysosomal storage disorders as well. This is an amazing project supported by the IGA, and others are coming slowly on board. And this is what we need. We need a whole community of people to work together, and I cannot thank the IGA enough for the support they've had from the very first meeting we had in 2016 in a small Gaucher masterclass to multiple events that followed, and now a program that has tested multiple patients. We also have a program of education, and very soon we will have 2 additional countries joining, and that roadmap will continue until we've filled up the whole subcontinent, which everybody has forgotten about. We do need your help, but I would like to recommend and ask you to support IGA in their work. They've been a fantastic partner for us.
In the continent of Africa, there are many countries with different religions, cultural background, and languages. It is not always easy to support the patients, especially when there are wars, political, and economic crises. One of these countries is Ethiopia. In Ethiopia, first we established contact with a couple of doctors like Dr. Tarek, Dr. Omer, and Dr. Ahmed Reha. Together with them, we organized a webinar. 140 health professionals attended that webinar, and they were all from Ethiopia. This got us to be more enthusiastic and to do more things in Ethiopia. So now we are supporting them with DBS cards for diagnosis through the Africa Roadmap project together with a rare cause. And also we are trying to support them in access to treatment through the Charitable Access Program of the International Gaucher Alliance. Another thing that's happening in Ethiopia is the development of a registry for lysosomal storage diseases, because this information will help in advocacy and policy changes. We have also been doing outreach in South Asia, starting with Nepal and Sri Lanka. Being reactive and proactive really makes a difference.
Sri Lanka is a low middle income country with 22 million population, which gives free health care for all citizens. However, there's a significant challenge in providing care for children with Gaucher disease in Sri Lanka. Not only children, even adults are not getting the standard care in Sri Lanka at the moment. We don't have diagnostic facilities in Sri Lanka in terms of enzyme assays and genetic analysis. Even though the genetic analysis is available in the private sector, the cost is not bearable for most families. Even if the diagnosis is made, we do not have enzyme replacement therapy, substrate reduction therapy, and hematopoietic stem cell transplantation in Sri Lanka to treat children with Gaucher disease at the moment. However, at one time, there were 4 patients with Gaucher disease receiving enzyme replacement therapy through the government of Sri Lanka. However, due to the economic crisis as well as the COVID pandemic, the treatment was discontinued for the last 4 to 5 years. In this kind of a background, we have been liaising with the International Gaucher Alliance to improve care of children with Gaucher disease in Sri Lanka. At the moment, IGA is supporting us to create a patient registry to get an idea about the scope of the problem. And also, they are helping us with organizing webinars and other workshops to create awareness among pediatricians. And most importantly, the International Gaucher Alliance is working to provide ERT through a charitable program offering hope for children with affected Gaucher disease in Sri Lanka.
We're excited to be working with Dr. Amalki, Chris, and the IGA team to build a registry for Sri Lanka. Our first priority was to build a safe, secure, and simple way to collect and manage patient data. But at the same time, we wanted to think bigger and reimagine what's possible with patient registries. We all know rare disease research is especially difficult, with small dispersed patient populations and regulatory challenges often limiting collaboration and negatively impacting research. To date, registries have been a very valuable tool for rare disease researchers, but we believe they have even more untapped potential. Imagine if we could connect all the registries in the world, creating disease-specific data networks that unlock novel insights and spark breakthrough research. And with the advancements of AI and other technologies, that vision can become and is becoming a reality. This is the exact vision we have in mind as we build the registry in Sri Lanka. For example, we're already having discussions with other institutions around the world on how we can leverage their data to build AI models that help streamline the diagnosis of patients in Sri Lanka. Ultimately, we want registries to move beyond fragmented static data collection mechanisms to become dynamic, connected ecosystem of data and insights that advance collaborative research and help improve patient outcomes worldwide.
Central Latin America is one of the regions where we realized the importance of language barrier and how it is easy to overcome it, cooperate, and learn from each other.
¿Qué tal? Mi nombre es Emilce Peña y quiero contarles un poquito sobre el voluntariado en IGA. Para mí fue y es una experiencia muy bonita. El año pasado tuve el privilegio de poder asistir al encuentro en Estambul, Turquía, donde aprendí mucho sobre el tema de Gaucher y sobre todo conocer amigos con mi misma situación. Así que ahora los dejo con mis compañeras Mildred, María Fernanda y Patricia, quienes nos hablarán un poquito de nuestra asociación Ángel Lisosomal Enfermedades Raras en Guatemala.
Hola, soy Mildred Martínez, soy de Guatemala y soy voluntaria para AIGA. Me involucro porque soy mamá de Rodrigo, un niño de 14 años con una enfermedad rara o poco frecuente. Como familia, sé lo difícil y complicado que es un diagnóstico como de una enfermedad rara. Espero contribuir de manera positiva y altruista para generar conciencia de una población poco conocida. Como voluntaria estoy trabajando para llegar a más médicos con material e información de calidad. Gracias, AIGA, por siempre apoyarnos.
¿Qué tal? Desde Argentina les cuento que junto con IGA estuvimos reunidos por Zoom durante el mes de mayo con Tania, Pesna, Cristian, Patricia, Luqui y Paulina Peña Aragón para poder ayudar en accesos a tantas personas de nuestro país que están sufriendo el acceso a sus medicamentos. También nos produjo una enorme alegría el año pasado saber que un joven argentino participó de WithGo en Turquía, y eso hace que el grupo de pacientes jóvenes de Argentina tengan otro empuje, otras ganas de participar, de adherencia en sus tratamientos, y repercute muchísimo en su futuro en cuanto a la salud. Así que les agradezco muchísimo la participación y el estar siempre presente con nosotros. Muchas gracias.
Hola, estos años han sido desafiantes. A pesar de todo, hemos trabajado mucho por fortalecer la comunidad Gaucher en la región, sobre todo en Centroamérica y el Caribe. Por eso hemos ayudado a pacientes en Ecuador, en Venezuela, a sus familiares en República Dominicana, en Nicaragua. Por eso también nos planteamos nuestro próximo congreso en la Ciudad de México, el 17 de octubre, donde vamos a reunir a pacientes y vamos a reunir sobre todo a médicos, tratantes y especialistas para que no se sientan solos, para que sepan lo que tienen que hacer, lo que pueden hacer y que en realidad estamos aquí para apoyarlos. Por supuesto, vamos a trabajar en inglés, en español, en todos los idiomas. Vamos a brindarles el mejor material posible para que puedan tener referencias. También estamos trabajando muy fuerte y seguiremos trabajando fuertes en apoyar el tamizaje neonatal de las enfermedades lisosomales, así como también en proporcionar mejores pruebas diagnósticas, tanto para el diagnóstico neonatal, para el diagnóstico de las enfermedades, como los biomarcadores para poder seguir viendo la progresión. Muchas gracias.
This hasn't been an easy region, but we now have two Gaucher leaders that speak the Arabic language and have connections to the region. We already have planned activities in Syria and Lebanon.
I joined the IGA with the aim of making a meaningful difference. As a Gaucher leader for the Middle East region, my aspiration is to ensure universal coverage and equitable access to healthcare for all Gaucher patients. To achieve this, Gaucher leaders and volunteers work together closely, contributing significantly to raising awareness, supporting logistical efforts, and identifying new patients. As part of our ongoing expansion, we have successfully initiated engagements in Qatar and Saudi Arabia. In Qatar, Gaucher disease is well known with many diagnosed cases, all of whom are receiving treatment, either from the government or pharmaceutical companies. The medical professionals here have 25 years of experience in managing the condition. In Saudi Arabia, there are many cases as well, and we are actively exchanging information to better support these patients. Looking ahead, our goal is to extend this outreach to the entire Gulf region, ensuring that more patients receive the care they need.
This is another difficult region, and our plan is to find a person who speaks the Russian language. Our Gaucher leader, Andra, is now a board member, and new volunteers are welcome to take over.
Many of them are developing countries. They do not have the rare disease organization, or it's difficult to find contacts online. If the countries are not part of EU, they do not have a unified rare disease plan, or the whole diagnostic system, health system is still developing. So I think our main mission would be to try to inform the medical professionals about Gaucher disease. I have managed to establish a contact with doctors or rare disease patient representatives from Armenia, Georgia, and Hungary. This I did during ECRD meeting in May in Brussels. I was very happy to find out that in Armenia, with the help of IGA, there was a treatment secured as a humanitarian aid. So there are success stories, there are challenges, but I think it's worth working with these countries, with this region, and trying to raise awareness about the Gaucher disease.
By working together, we aim to improve the lives of Gaucher patients through access to diagnosis, treatment, and information. By showing what we can done in one country and in one rare disease, we are actually showing what can be done in others. We are sure that working with the right partners will help us overcome the challenges of human and financial resources, and we are sure that this program will progress in the future and help many patients globally. IGA is grateful to have dedicated volunteers and collaborators. We can do everything because of them.